Joining me today is Dr. Carl Freeman, orthopedic surgeon at the Jacksonville Orthopedic Institute. Doctor, thanks for being here.
Thanks for having me.
Well, as we like to talk to all the orthopedic surgeons at JOI, of course, keeping athletes in the game and all over Northeast Florida. And of course, you've found your way here, I guess. And could you tell us a little bit about how you became an orthopedic surgeon?
Well, I grew up in Nashville, Tennessee, and then I went to Creighton University for undergrad and Georgetown for medical school.
Basketball school.
That's right, both basketball schools. And then after medical school, I joined the Navy, and it was the Navy that brought us to Florida, to Jacksonville, and I served here at the Naval Hospital for 4 years. After getting out, I joined our group. We decided that we wanted to make Jacksonville our home.
Well, I know you mentioned you had the opportunity to go to Afghanistan. I'm sure that was a difficult time.
It was challenging, but I learned a lot, and I was proud to have the opportunity to serve.
Well, I know one of your areas of expertise is hips, and I know a lot of times when we think of hip issues, we may think of elderly people, but you find hip issues in a lot of sports.
Well, I have specialty training in hip surgery. In fact, hip preservation surgery is what we're calling it. And the thing that's interesting is that a lot of those folks that when we were younger were having groin strains or pain in the groin area, were actually probably having hip problems. It turns out that there are a lot of young athletes who suffer from a hip disorder. One of the most common ones is femoral acetabular impingement, or FAI, which is hip impingement. It's a painful mechanical disorder of the hip.
And what kind of ages are you seeing these issues? I mean, can you see them in young athletes?
We can. I've seen severe cases of hip impingement in patients as young as 16 years old, but the most common age is a little bit older than that, into their late teens and early 20s is most common to suffer from hip impingement that requires surgery.
Well, can you tell us some symptoms if you're having, and then treatment for those, and then recovery time?
Sure. Well, the key to identifying hip impingement is this is a painful mechanical disorder of the hip. It's associated with groin pain that's associated with activity. So activity-related groin pain, and the treatment of it, we have a great strategy for physical therapy for these patients, and if they're not able to have their pain improved with physical therapy, then we have surgeries for them. Both hip scopes, so that's arthroscopic surgery, and open surgery can be used, open surgery being reserved for the most severe cases.
What's the recovery time?
Recovery is similar to an ACL, so a couple weeks, 2 to 4 weeks on crutches, returning to normal activities pretty quickly, and then return to play would be around 6 months.
So I guess normally, I mean, if I think of hip, and I know years ago, if you think of hip problems, you think, well, maybe your career's over, and that's not the case today.
That's not true. We're not currently. We're trying to get these folks back into the game pretty quickly. The goal is to restore the athletics ability to do whatever sport or whatever physical skill set that person had. And that's why the key is to get to these folks early and try and treat them with physical therapy or surgery and get them back.
Are there any sports where these hip injuries are more prevalent?
Well, classically, hockey has the highest rates of hip injuries and this hip disorder. I was talking about hip impingement, but most of the collision sports have high rates of it, such as football, soccer, those type of things. But even non-contact sports can also have high rates of hip impingement.
Well, it seems like I mean, medicine today, there's a lot of advances being made, and certainly here with hips, you see it just really progressing and being able to get people back in the game. And I know you and I were talking earlier and in our conversation, and you mentioned you really didn't know you wanted to be an orthopedic surgeon until you were in med school. And tell us a little bit why that is.
Well, I had always wanted to be a surgeon, so I went to medical school knowing I wanted to be a surgeon, but when experiencing different specialties in medicine, I discovered that orthopedic surgery, we were kind of the surgeons that use tools the most. We really rely a lot on tools and implants and devices, and that really kind of drew me in, the thought of using some of these really interesting tools.
Well, that's very interesting, and of course the Jacksonville Orthopedic Institute here keeping athletes in the game, and never really quite thought about it like that, using tools, but I guess that is the case.
That's us. We're kind of the carpenters of surgeons.
Well, that's great. Well, Dr. Freeman, thanks for being here today, and as always, Jacksonville Orthopedic Institute keeping athletes in the game all over Northeast Florida.
Thank you for having me.